monies that have been set aside to address all of these programs that are included in the plan. So again, what I gave you were just highlights of this particular program. But I think it's a very significant plan. It's important to say, though, that we wouldn't expect, and that's why, we pride ourselves in having a country of democracy. Some people are not going to like the plan because they think it's advocating a single-payer system. That's not necessarily true. This plan provides individuals as well as small firms an opportunity to select, from other insurers, on what you are able to afford in a lot of ways. But the important thing is that the government wants to be there. The government wants to improve efficiency. And when I talked about you remember I mentioned the reserve fund earlier on, that fund is going to be funded through two sources. One is going to be, once we cut out all the pork, all of the inefficiency we had before, all of the monies that have been spent in the healthcare system that are not supposed to be spent in the first place, these monies are going to be used to continue to fund this reserve. That's number one. And then, of course, we'll generate new funds, so other sources that will be used collectively to fund this particular effort. So again, it's very important, but the critics are going to be there. There are those who are, like I said before, are going to say, it's a one-payer system. And we know some of the disadvantages associated with the one-payer system, which some people are now trying to blow out of proportion. They say it's very complex, and the United States is a very culturally diverse population. So maybe just because a one-payer system might work in Canada or maybe in Britain doesn't mean it's going to work in the United States. There are those who argue that it's going to run down the facilities, because everybody is going to think, oh, it's free for all, and then there's, going to be all of those disadvantages. So we have to think about all of that. But
in all of your work in public health, do you believe that this is a very, very efficient kind of plan in terms of trying to meet the needs that we have dealing with health in the United States?
I think, as the plan itself says, this is an improvement on what we had before.
That's right.
So the point here is we are not looking at something that is going to be a total panacea to the problem, but we are looking at something. If you